Having a little chat. Well, Maria Eagle is Labour MP for Garston, and she's been talking to our political reporter Claire Hamilton about Marie Curie.
I'm pretty disgusted about it because I've been talking to Marie Curie since last July when they closed the beds in the inpatient ward temporarily, they told me. I've had many meetings with them and they've never said to me that they wanted to close it permanently. They told me originally that they couldn't get the right number of specialist staff to keep it open. And that I asked them, because there were rumours at the time that they wanted to close it permanently. So I asked them whether that was the intention, and they always denied it. But now we see that that's what they appear to be doing. So it's pretty disgusting.
And they've said that it actually comes down to money and the amount of money that would be needed to continue to operate an inpatient ward. And they've said that both the ICB and they themselves are running at a deficit. So even if, millions of pounds was raised in fundraising every year, so much more would be needed, they say, in order to maintain an inpatient unit, that it's just not possible. Do you buy that?
Well, no, I don't buy that. They've been given money by the ICB for the last year to provide inpatient services, which they haven't done. Hospices are never fully paid for by the ICB. The arguments that Marie Curie used with me when I went to see them a year ago was that they had a staff shortage, not that they had a money shortage. Every hospice could do with more money, but that was not the reason that was given to me. And I was assured they wanted to reopen it, and if they could just get the right staff, they would. And I've been in good faith trying to assist them with that, brokering meetings with the ICB. I think it's right that assistance, if people want to die at home and it's possible, then if people prefer that, then it's good that can be supported. But that isn't everybody. And we know whilst this facility has been closed, while the inpatient beds have been closed, more people from South Liverpool who needed those services have been dying in hospitals in settings that aren't as appropriate. And so I was very keen to get these inpatient beds reopened. That's what I've been working on. So it's a real shock for me to see the news. And I've heard from some of the staff who were told about this on Zoom or on Teams. And I just think the whole thing is appalling.
And do you think there's a reputational damage to the charity? Marie Curie is a beloved charity for many people, and people donate in good faith in Liverpool. And I think it's fair to say a lot of the time they do it in the expectation that some of that money is going to go to fund the Woolton Hospice, which is very well known in our community.
It is very well known and very well thought of, and the staff there are very well liked. And I do think that Marie Curie have done themselves reputational damage. And I'm just appalled. I think it's terrible. And I need now to talk to the ICB about restoring some inpatient palliative care in South Liverpool because the community needs it.
Campaigners have told us they want some sort of public inquiry initially into Marie Curie and the way that it's conducted itself here, but also into the wider issue of hospice funding and whether it should be incorporated into the NHS. What's your response to that?
Public inquiry you have to have very particular circumstances. I think we need to get to the facts about why Marie Curie have done what they've done. And so I do think there are questions to be answered. I will certainly be taking it up with Marie Curie further. But they're a charity. I don't think you can have a public inquiry that will get the information that's needed. But I can understand why campaigners want to know what's gone on.
It's not so long ago, Maria, that Liverpool had essentially a massive people-powered fundraiser to save Zoe's Place, the children's hospice. Yeah. Do you think something similar could have been a solution for Marie Curie?
I do know that Marie Curie have never tried to engage the public in South Liverpool in that way. They've never said, look, if we don't raise so much money, we're going to close. I just got the sense from their chief executive that they were very keen on providing services in a different way.
That was Maria Eagle, Labour MP for Garston, talking there to our political reporter Claire Hamilton. And we have had a statement from NHS Cheshire and Merseyside that says the organisation has been working with Marie Curie. Unfortunately, these efforts have not resulted in a sustainable long-term solution either for NHS Cheshire and Merseyside, Marie Curie or local patients. And we have now confirmed that we will instead work with wider health and care partners, as well as Marie Curie, to develop and agree a new clinical model, including the provision of inpatient beds. Now, I know a lot of you in the past we've covered this story quite a lot here on the Brekkie Show. Lots of people across Merseyside have connections to Marie Curie, the inpatient unit at Marie Curie. And I know lots of you have been in touch with us before about, you had a loved one there and you wanted to share, what they done to you to help you. So if you've got something you want to say on this morning, then absolutely give us a ring, 0800 731 9333. You can call